Hi, everyone. Welcome to today's webinar. My name is Dr. Kim Hikimian. I am the director of the Masters of Science program in Human Nutrition here at the Institute of Human Nutrition. And we welcome you to today's webinar where we'll describe our program and answer your questions. I'm joined by two alumni, distinguished alumni of our program who are volunteering their time while in the middle of a lot of busy scheduling at medical school. So I'd like to have them introduce themselves, and I thank them in advance for their time. Eric, can you introduce yourself?
Yes. So hello, everybody. My name is Eric Wong, and I was a class of 2022 graduate of the IHN MS program. I went to NYU for my undergrad and then subsequently matriculated into the IHN where I did my one-year master's. Graduated in 2022, and I actually stayed on as a TA for the following year. And currently, I am a first-year medical student at the Geisel School of Medicine. Actually, almost out of my first year, so I'll almost be a second year. So yeah, that's who I am, and really glad to be here today.
Thank you. And Julian, can you introduce yourself?
Julian Gallegos, graduated from IHN in 2020. My last year of medical school at SGU, and yeah, that's pretty much it.
All right, you're in the middle, I know, of your psych rotation. And
yeah.
I think, Eric, you mentioned you're studying the reproductive system right now. So again, we thank you very, very much for your time. Okay, I'm going to ask you guys to mute. You'll come back on when we do classes and thesis, okay?
Sure.
All right. So, in addition to myself, on this webinar today is Alex Sosa. He is on the left of me in this photograph, to my right, on your left. And he is the Senior MS Program Coordinator. He is on the call and he will happily answer questions when we get to them in the question boxes. And in addition, our MS Program contacts include Dr. Monique Madra. She is the MS Program Associate Director. She's on the other side of me. And she teaches coursework in physiology through the life cycle and also in integrated nutrition and pathophysiology, our clinical nutrition course. And she also ushers students through the thesis planning and thesis writing process, which we'll get to as well. In addition, Sarah Berggren is the senior manager, and she is in contact with you or those of you who have started applications. And if you start an application, she will be somebody who will be coordinating with you for any questions you have on that. So I will speak for hopefully less than 30 minutes about our program, and then we will stay on as long as you would like to answer your questions. You can type those questions into the question box on the panel in the GoToWebinar. I will cover why we think it's so incredibly important to get a Master's of Nutrition Science. I'll go through our one-year curriculum and ask the alumni to talk about how they felt about the coursework, and then we'll talk about your personal professional growth, some career pathways that students take, and a little bit about student life before we show you the application information. Why get a master's in nutrition if you're going into the healthcare world? Nutrition is the leading determinant of the largest number of causes of death in the United States and globally. So if we look at heart disease, cancer, maybe not so much unintentional injury, COVID-19, stroke, respiratory illnesses, Alzheimer's disease, diabetes, of course, kidney disease, and liver disease, right? These are the leading causes of death in the US, as they are in much of the world. And they all have a relationship to nutrition. So in these areas of mortality, nutrition can play a role in either prevention, right, or stemming the progress of a disease or in treatment of the disease. And yet, most health professional schools, whether it's in medicine, PA programs, nursing, most of the health professions do not teach much about nutrition science. And that is the gap that we feel very strongly we address. Now, just one more slide of a graph. This is from an article in JAMA. It was done by the Institute for Health Metrics and Evaluation out at the University of Washington. And it looks again at the risk factors related to mortality between the years 1990 and 2016. It's called the Burden of Disease Study. And what we see in the Burden of Disease Study is that poor quality diet, high blood pressure, high body mass index, high fasting plasma glucose, and high total cholesterol together account for the largest amount of burden of disease. And I again stress that this is the leading issue, but again, many health professional schools do not teach about nutrition science in a sufficient way to be able to handle patient demand and questions about this. Before I move on, I just want to show you that tobacco use is also still very, very high. So while I always make the argument that nutrition is the leading determinant of death and much of the disability in the United States, tobacco use is still very, very important in terms of helping your future patients, family members, friends for maintaining health. Okay. So where do we do this study of nutrition science? We do it at the Columbia University Irving Medical Center, which is located in the upper west side of Manhattan in a neighborhood called Washington Heights. And CYMC is a world-class leader in scientific research, health and medical education, and patient care. For those of you who are not familiar with this photo, this is the Hudson River, which separates New York from New Jersey, and this is the George Washington Bridge, which exits into Manhattan at 178th Street, and our program offices are located on 168th Street. So those buildings that you see in the background are all on the Columbia University Irving Medical Center campus. I'm going to spend a minute on this slide. It goes through our one-year program curriculum and coursework, and then at the end of my description, I'll ask the alumni to come on and talk about what they liked in terms of their coursework with us. So in the fall semester, all classes are taken together. They're all required courses, and the cohort takes them together. In the spring, you have some required coursework, but you can take elective coursework. You can take elective coursework in this gray box, that's our coursework, or you can take coursework anywhere else on the campus. We will talk about that. And then in the summertime, you do not have required coursework, but you're required to work on your thesis until you complete those thesis guidelines. So let me now unpack that. So fall semester, you start a full year series on biochemical and physiological bases of nutrition. So in the fall semester, you'll review how the body metabolizes macronutrients. And in the spring semester, you'll look at the micronutrients and all the vitamins and minerals, right? So how the body metabolizes. And then you'll take, in the fall semester, physiology and nutrition through the life cycle, starting at pregnancy, going to infancy, young childhood, adolescence, adulthood, and older adults, looking at the role of nutrition in normal growth and physiology. And then you'll have the introduction to epidemiology for nutritionists, which will teach you about the hierarchy of study design and the strengths and weaknesses of study design and how tricky it is sometimes to be able to study the role of nutrition in health outcomes. The critical readings course, you were broken down into smaller groups and you meet somewhere around 12 to 15 students and you sit around and pull apart some of the peer-reviewed literature on nutrition, either in basic science, clinical research, or public health. And the public health course is what I teach, the Introduction to Public Health Nutrition. That course talks about what are the national dietary guidelines, how are they developed, but why is it that most Americans are not meeting them? We talk about issues like food insecurity, health literacy, and so on. And finally, in the fall semester, you'll be meeting with the Thesis Planning and Research Methods team. This is a course that introduces you to the mentors on our medical campus that are working with students for their thesis research, and then they will help you choose where it is that you would like to do your work. In the spring, as I mentioned, you continue with biochemistry, but you also have an integrative nutrition pathophysiology course, which again takes those top 10 causes of death and breaks them down by, the medical nutrition therapy for each one. And then you continue along working along your thesis. And finally, in the summer, you finish up your thesis work. As I said, in the spring semester, you can also take spring electives. They're listed here in this gray box. And before I ask the alumni to jump on, I'll just point out, for those of you on the call who are interested in applying to medical school, the courses that have this diamond bullet in front of them count for the AMCAS BCPN credits that you could list for your science GPA as you apply to medical school. Okay, so I spoke a lot, so let me just now I'll invite Eric and Julianne to come back on. And Eric, the question I have for you is, which of this coursework did you either enjoy or find important to you as you are now in your medical school career?
Yeah, so I think that's a really, really great question. So before I came to the IHN, I was very much in tuned with the basic sciences since I majored in biochemistry, and I also did a lot of basic science research. So before coming to the IHN and seeing the curriculum that was kind of proposed here, I was really excited to take the biochemical and physiological bases of nutrition courses, since it's something that's kind of up my alley and something I found like I would really enjoy. And actually, I really enjoyed it, but also I found it really relevant to the kind of coursework I'm doing now here at Dartmouth for medical school. I was just talking to Dr. Kimeen before we started this call, and we actually had a GI midterm on Monday, which had a lot of content that was very much covered within the IHN. So I think that really demonstrates how the IHN curriculum really prepares you for a healthcare profession like medical school, because a lot of that overlap is very much there. But even aside from the basic science coursework that I had at the IHN, I also really enjoyed the fact that it was so multifaceted in terms of having public health coursework, like the course that Dr. Kimian teaches, as well as kind of more clinical-based coursework like the pathophysiology course that you'll see in the spring with Dr. Madra. So in general, really, I felt like I got a really wonderful, multifaceted nutritional education that I feel like I am definitely applying in medical school, since you'll see a lot of overlap in the topics that you will be learning in medical school with the curriculum that you're going to be having at the IHN.
Thanks so much. And Julianne, do you want to give a few thoughts on the classes that you liked or that you took with you now that you're finishing up medical school?
Sure. Every time I do this, I always harp on biochemistry, because I really love those courses and the way they were taught. But over the course of like this third year and like kind of just getting to the hospital and working clinically with some of these patients, there's some lectures that I actually ended up going back to and reading, and some things there was an introduction to public health nutrition, Dr. Akimian, that I think you taught. And it was there's certain like health disparities and issues that people have in getting access to like proper nutrition that's really covered in this, that is not taught at all in medical school. And it's kind of something you just really learn on the job. And this is something that nurses, doctors, PAs, NPs have to deal with on a daily basis, especially in a public hospital where you have patients that are homeless or coming from different countries that just don't have access to the resources that a lot of people here in this country do, or even people in this country don't have access to. So kind of getting ahead of that with this program, and a lot of the things that were taught in that course specifically, I actually referred back to in looking at like how to really deal with some of this stuff and kind of refresh myself. So that was very, very helpful. Yeah.
Thank you so much. Thanks. You guys can pop off just for 1 or 2 more slides, and then I'll have you come on and talk about your thesis as well. Okay. Thanks. So as I mentioned, we do have a lot of interesting spring electives you can see in this gray box here on the right, but we also allow you to create your own pathway by taking coursework anywhere at the university at the graduate level. And some student favorites of courses that have been taken are listed in alphabetical format here down at the bottom. We have students who take coursework in basic sciences, again, wanting more science, but we also have students who take coursework in the business school, engineering school, law school, school of public health, because they're either exploring other avenues while they're with us, or they're thinking about how they want to gain information about a certain area that they're interested in for their career. As I said, one of the jewels of our program is in fact the thesis. It's very rare to have a one-year Master's of Science program that also includes a hands-on thesis research component. And we offer students to be matched with mentors that are already working on these areas. So you don't come up with your own topic per se, you meet with and choose a mentor to work with for the year on various areas. And we have more mentors than we have students. Mentors are very happy to work with our students. And in general, they fall into 3 buckets of research: basic science research, so lab research, wet lab, dry lab, animal models, and so on, clinical nutrition, and also public health nutrition. And about 1/5 of our students publish their thesis work. Very often they stay in touch with their mentors after they've finished their thesis and continue to write the manuscript and get credit for the contribution that they made while they were here with us. So with that, I'll invite Eric and Julian to come back on, and I'll ask them each to describe the thesis work they did when they were with us. And we can start with you, Eric.
Sounds good. Yeah, so for me, my thesis project was kind of in the clinical and public health bucket of these 3 categories. So I did a cross-sectional study on the effect of smell and taste dysfunction on what is it called? Decreased mental health capacity in older adults, and whether or not that particular association could be mediated by decreased dietary quality. And so I feel like I learned a lot during this project, especially in the realm of biostatistics, which ends up being very, very important in the realm of science research in general. So I think my project was primarily statistics focused. So I took a lot of data aggregated from the NHANES survey, which is publicly available survey that you can get the data from online, and basically analyze that data to see if you can find any trends to kind of help aid research in the future. And so I think that was very, really helpful, because a lot of what you're going to be doing in the IH and also in medical school is, being able to kind of analyze data and read papers and be able to understand what the statistics is saying. And so being able to do such a project, I think, really helped in that realm. But in general, I feel like the topic that I explored was really of particular interest to me, since I do have an interest in neurology as well as the connection to nutrition. So in general, I thought it was a really, really fruitful project, and I really enjoyed it.
Great, thank you. And Julian, what did you do for your thesis when you were with us?
Yeah, so I did also worked in a clinical setting as well, in a sleep center at Columbia, and we focused on looking at sex differences, the cause of like circadian misalignment, and the effect on like energy metabolism. So we would have these patients come into the lab, they would have their blood drawn in these like 1 to 3 hour intervals, and they had to stay in this chamber that, where the oxygen was like regulated, and essentially there was a sensor that like detected any shifts in the O2 content in the air that the patient was breathing, which is like the most accurate way to like track somebody's metabolism. And Columbia only has like a few of these rooms. I thought it was really, really amazing, and they're really not that common across like different research institutions. So it was really cool to get exposed to that sort of I guess environment. But anyway, so we focused on that, and I did have the opportunity to publish my paper and present my paper at a few different places. So it was a really, really amazing experience, and the publication itself kind of set me up to conduct subsequent research, not necessarily in the same field, but like
Right.
you publish one thing and it kind of opens doors to publish other things and do research in other areas. Yeah.
Great. Okay, I'll have you guys mute until we get to the Q&A, and I'm just going to go through another few slides, and then we'll open up for questions. Thank you so much. So as Julianne mentioned, many of our students do end up taking their thesis research and presenting it either in oral presentations or poster presentations at national and international meetings. And we're very proud that we can support that with giving you some, being able to subsidize some of the travel or registration for when you do present your data. And these slides you'll be getting a copy of them at the end of this webinar, and you can look at some of these titles later on. So we've gone through the academics and we've gone through the thesis. So now I just want to say that in addition, this is a year of tremendous growth for a lot of students, and you will be growing professionally and you'll be continuing to grow personally as you go on this journey. You really do appreciate the idea of academic integrity, not just in the classroom, but also within the realm of research. You will improve your formal presentation and public speaking skills because you'll have to do that in some of the classes, but you'll also be presenting your thesis. And you gain your interviewing skills. You'll be interviewing with mentors about the thesis that they're, the research that they're doing. Some of you may be interviewing for professional schools or for jobs, while you're with us. This is an intense and fast-paced program, so your study skills and time management skills will also improve, and that's something that students take with them no matter what they do at the end of the program. And you'll get better at feeling comfortable speaking extemporaneously, particularly about your research, because people will be asking you all the time, what are you working on? Finally, you'll continue to develop writing, and particularly science writing. And in the end, of course, you'll be writing a thesis, and many of you will be writing manuscripts for publication as well. In addition to that list, we have opportunities for you to develop leadership skills as a student representative. It's only a one-year program, but we do have a student government, and the student government has co-presidents for the class, and then they have the chairs of various committees. Here you can see the professional development committees as social and wellness, community service, and so on. But you can also create a new committee if you feel that there's something of interest to you that others would benefit from your leadership on. You're welcome to consider creating a new committee within the community. Each course has a student representative as well, so that the student representative can gather feedback from the class as the course is moving along and give that feedback summary to the course faculty so that we can attend to whatever the issue is in real time. Of course, we're located in New York City, which has a very high prevalence of food insecurity. And you can make New York City part of your learning lab with community service. So in every area of community service, you'll find a group in New York City that welcomes your support. We do have a series of opportunities for you to volunteer in spaces and organizations that are working to decrease food insecurity throughout the city. We pride ourselves on being a passionate and accessible faculty. We try to meet with you at various events, host in-class discussions. We have our office hours, but we meet with you at any time that you need. And I know this is self-serving, but really our faculty are, again, another jewel of the program. We really enjoy our students and want them to meet their goals, whatever those goals are in the year that they're with us. And as you can see, I mean, Eric and Julianne just completely volunteered for this, and you know how busy they are, but they feel like they got something important from this program and want to give back. And we do have a very strong alumni network that feels the same. We try to work on some career development, but the goal here is to prepare you for a fulfilling career and assist you with discovering your strengths and exploring other opportunities for further graduate or professional degrees. Some students come in certain they want to go to medical school, but they get exposed to so many other options during the year that they change their mind. Others are on the fence about whether they want to go to medical school or something else. Many of our students come in certain they don't want to go into the health professions, but they want to do something in healthcare. So they might be interested in going into industry or going into startups that are working on how to improve access to healthy food, you know, for all of us. So we have a pre-health consultant who is a pre-health advisor at the post-bac program who can meet with you, and we have career path discussions. And again, we have this connection to a very large alumni network who represent sort of a very, very wide range of careers that people go into. In addition to the IHN resources, you are a student at Columbia University when you're with us, and so student resources are everywhere. We have a student health and well-being center. University Life does a lot of student events, and you can get discount tickets. You have access to all of the libraries, all of the you know, gyms and fitness centers throughout the campus. So really our faculty, staff, and alumni are here. We're behind the scenes to ensure that you have a really good experience when you're with us. Our students, we want them to find a good work-play balance, and we really want you to explore New York. New York is an amazing city for those of you who are not familiar with it, and we, you know, we are an intense program, but we also think about the needs of the students, and we encourage you to take advantage of what New York has to offer when you can manage that in your, you know, in your study time. We start at the last week of August and we go through the following summer, but we do commencement in May. And so you finish and celebrate the end of your 2 semesters in May with commencement and the class day, where you celebrate the fact that you are, you know, the next day you have to go back to your thesis setting, but it celebrates that you finish these 2 semesters. And as I started mentioning earlier, post-graduation, these are the top fields entered by our graduates in alphabetical order. So we do have 2 alumni that are in medical school with us today, but we have about 1/3 or maybe up to 40% sometimes of the class that go into other areas, including, you know, consulting or health policy, law school, public health. They go into research, they go into PhD programs. So there really is a very wide range, because nutrition science and the kinds of critical thinking skills that you develop in this year, you can really take and apply to a wide range of professions. So finally, the last 2 slides, I want to just discuss applying to our program. And as I have this quote here on the left, which says that your entire record is reviewed, no one score or one component of your application would make you automatically non-competitive. We take a holistic view of your application. That being said, students with the following tend to thrive in our program. I mean, generally speaking, a GPA of 3.2 or above and doing well in your science classes really, you know, means that you're very well prepared to take our coursework. If you have a GRE or an MCAT or a DAT, we ask that you submit that, and scores that are above the 60th percentile, again, people tend to thrive in our program with those 2 components. We do recommend a standardized test score, but if you don't have one, you're not required to submit that in order to have your application, in order to submit your application and have it be reviewed. We do, however, have some prerequisites for our coursework, and that's at least 1 semester each of biology, chemistry, and organic chemistry. Biochemistry is really recommended, but you don't have to have it in order to be in order to apply in the program. And we have had students who have been able to thrive in biochemistry even if they didn't take a course in that beforehand. As many of you probably know, this is a rolling admissions program. So we've opened the program in December and we will be closing towards the end of June. We will let you know as our class fills, but there is still plenty of time to apply. Currently, we do have spots still available. And finally, 2 of the most common questions. This is my last slide, and then we can go to questions. You can start putting those into the box if you want. Unfortunately, like most master's degrees, we don't have much financial aid in terms of scholarship. We have a limited amount that is needs-based scholarship for accepted students, and we do honor the Yellow Ribbon Scholarship for U.S. veterans. But we have a wonderful financial aid planning office that prepares loans for students and can refer you to other external scholarship opportunities. Housing is also another question. We are in New York. We offer both on and off campus housing options. And just like I mentioned, having a great financial aid office, we also have a really great housing office. So, as soon as you apply and are accepted, you should jump to both of these two offices to start to make plans. And that's all I have today for my part. Thank you very much. This is a photograph of Dr. Madra and I at commencement a couple years ago, and this is a photograph of Haven Plaza, which has our bookstore cafe and some classrooms and a place where a lot of students hang out in between courses. So I'm going to stop sharing and open up to questions. And I can have the alumni join me. Okay, Alex, I'm opening up for questions. Okay, so a question to the alumni. What is it that you wish you had known about this program before you attended the program?
Yeah, so I can go first. So I think it's kind of abstract, but I do think because it's a 1-year program, you might think the 1 year might go kind of slowly, but in reality, it actually goes by super, super fast. So I think really when you're there, take your time to really enjoy the program. I know it's going to be a lot of coursework and you of course want to do well in the courses, but also I think it's important to really take that time to really enjoy being a part of the program, enjoying meeting people, forming relationships, and exploring the city as much as you can, just because I think it's a really wonderful opportunity to be living in the city. But yeah, like I think really you're going to be learning so much and doing so much during the program that in the beginning it might seem like it will take a long time to finish, but in reality it goes by super quickly, and then you'll have your MS in human nutrition before you know it. So I really do advise you, if you do end up coming to the MS in Human Nutrition, really just take that time to enjoy it and yeah, make the most of the experience you have at the IHN.
Thanks, Eric. Thanks. Anything to add, Julianne?
Yeah, it does go by very fast. I will second that. It is an intense program. I think it does a very good job of making sure that you're prepared for medical school in the way that you have to study. Obviously, medical school is a little bit more intense in terms of volume, but I think IHN does a really good job of pacing. So it is definitely a lot, but I wouldn't say it's too much to handle. But I wish I had known that going in, so I would have been a little bit more prepared, like I think, mentally going into it.
We have another question for both of you. Julianne, I don't remember when you matriculated, but the question is, what opportunities did you explore between completion of the program and matriculating into medical school? So Eric, if you want to talk about that, you applied, I believe, the cycle right at the end of our program, or is it a year after our program? I don't remember.
Yeah, I applied in the cycle right after the program ended, or basically during my graduation year. So I applied in 2022 and matriculated the year after in 2023. And so in between that time, between matriculation and I graduated, I actually stayed on at the IHN as a TA for the biochemistry and biostatistics courses. So
Yep.
I actually thought that was really, really nice, just because I was kind of on the other side of the education. Yeah, so it was a really great experience meeting the new students and also kind of reinforcing my own knowledge on the topics I was teaching. So that was wonderful. And then also I had a part-time job at Mount Sinai Morningside, which is right next to the Columbia main campus, where I worked as a clinical research coordinator for Dr. Alan Galipter, who actually is a mentor for the IHN thesis program. And that was really nice too, because I got to utilize a lot of the biostatistics knowledge I got during my thesis and the work that I did for Dr. Alan Galipter. And so that was really wonderful. I think that really ended up helping my application. So
Great. Julianne, you want to tell your story?
Yeah, sure. So I applied to medical school while I was at IHN, and in between, I guess it would be that there wasn't really an in between. There was a lot of overlap, and so like writing my thesis, but then also publishing the paper ended up falling on the first 2 semesters of medical school. And I had also picked up some other research with a different lab while I was at the IHN, so I was also doing that as well. So having that year gap, I think if we could go back and talk about things I wish I had known, a year gap in between those two would have, I think, been great. I think that was your situation, Eric. It kind of slows things down a little bit, get a little bit of a breather. But having done it and not having that gap, I will say, is very doable too. So just transitioning from one to the next is very possible. But yeah.
Thanks. All right, I'm going to take a couple of these questions. One is, do students get their first choice for joining faculty research? So the process is that in the fall semester, you'll be introduced through a mentor handbook that is developed the summer before the program. Not every mentor works every year with our students. Sometimes we get new mentors. Sometimes the mentors are closing out one research grant and starting a new research grant. So the mentors will be listed, and then you will learn about their research and what they're looking for in a student for the year. And then you write to the mentors that you're interested in, and you ask for an interview with them. And then when you interview with them, you kind of are checking them out. They're kind of checking you out. And, you know, there's a little bit of a match or mini match sort of situation that happens. And, you know, and then you find out, you know, they sort of by the middle to end of the fall semester. But believe me, there are a lot of interesting topics. We ask that students wait to think about where they want to be until they look at the mentor handbook, because you know, one day you might read or meet a mentor and say, well, I really want to do that. But then the next day you'll see something else and say, no, I really want to do that. So that's what's sort of exciting. I'm sorry that I seem to have lost the second question. Sorry, with the multiple questions question, Alex, I lost the second piece of that. But if I didn't answer, please feel free to jump in. I do have I think there was a part of the question that asked how many students go on to become RDs. So registered dietitian nutrition program, the program that certifies registered dietitians if you want to become a registered dietitian, is at the Teachers College at Columbia University. Nonetheless, all RDs need a master's degree. Some programs have that embedded in their program, but some students come to us with the RD degree and they do their master's with us. And some of our students have gotten more exposure to the role of the RD after they've finished our master, you know, as they're finishing our master's program. So then they apply to RD programs. But I would say that every year it's about a handful of students to answer that student's question. There is an RD on the call, welcome, who is wondering if this is something you can do part-time. I would suggest that you reach out to us directly so we can give you all the details about scheduling and things like that. We do allow students to do the program part-time, but we need to sort of look at the academic plan with you to make sure that it meets your needs in the best way. Our courses, for the most part, are held in the afternoon, but we have a couple of required courses in the fall semester that are in the morning. So let's work offline together and see if this is a good option for you. We'd love to have RDs in the program because they help us out as well when we're talking about food and recipes and diets and things like that. Typical class size for the program is around 60 or 70 students. And some years we have a smaller class size and some years we have slightly larger. That is large enough where you can find your own people socially, and small enough where you get to know everybody, which I think is really great. there are courses that are smaller in size. So the critical readings course, you'll be broken up into, you know, somewhere around 12 to 15 students. So you'll have a smaller group be able to pick apart the journals that you're reading. And then some of the electives in the spring are also smaller too, because the whole class has to sort of choose what they're taking in the spring. So good question. You talked about opportunities regarding volunteering to help fight food insecurity, but what about opportunities to volunteer at the hospitals that serve underserved populations around the university? So I think I'll ask Julian to talk about his work volunteering for a student-run clinic. Do you mind describing that experience?
So Cosmo Clinic is a clinic that's part of Columbia University. It mostly serves underserved populations, uninsured populations, different groups of people. Anyway, it's a student-run clinic through the medical school, but they also have like people from the IHN that can go there and volunteer. So I went there pretty much the entire time I was at the IHN. You go there, you can go there as well, depending on how their scheduling works, but I went there Saturdays and Sundays during my time at the program. And what you do there is you speak to patients. You are the nutrition counselor for all the patients that come into the clinic, and the attending that's on shift will review your recommendations and treatment plan and things like that, and then bless off on them or tell you what needs to be revised, but you work with the attendings directly and the patients. In addition to that, there are other opportunities for like outside of just like the basic courses, like to shadow other doctors in the hospital. I shadowed a gastroenterologist at Columbia, a pediatric gastroenterologist as well, and a cardiologist. So there's definitely some opportunities to interact with those different practices and specialties. But the Cosmo Clinic was excellent, and I highly recommend it.
Anything you want to add, Eric? I would add that we have an elective course in the spring semester, which is called Clinical Observations. And it's a course, it's only a 1-credit course, but the course brings you into the classroom with a few lectures on how to take a history, how to deliver bad news, and then you sign up for shadowing hours with a variety of health professions in the hospital, and then you come back to the classroom to present a case that you saw in the case presentation format that you would utilize if you do go into a health professions graduate school. And as Julian mentioned, and I'm sure Eric, you felt this way as well, there are opportunities to shadow in addition to that course in the spring. There are opportunities to shadow. Okay, so a couple of people thinking about taking the program part-time. So what I would ask you to do is you're going to receive all of this information about the webinar and the slides and everything in a follow-up email, and you're welcome. And I think all of you received an email from me yesterday telling you that I was going to be on the call. So please feel free to write me directly, and I'll have you meet with Sarah Berggren to talk about the schedule and whether or not a part-time option is feasible for you. Okay. Well, this is a great question, and I'm glad that you brought it up. This is a question about, do students feel like the classroom atmosphere is welcoming and helping each other, or do you feel like you're competing with each other? And let me just say, from the faculty and director's perspective, we're educators. We understand and love to learn about the educational pedagogy and the science of learning. What we know is that working together in groups and studying in groups is really very helpful to the learning process. And we encourage people to study in groups because we don't have a weeding out atmosphere. We're not trying to weed you out, and we're not curving down. We are, if everybody gets an A on the biochem quiz, then everybody's going to get that A on the biochem quiz. That's how we operate. And for that reason, I feel like it's really important to communicate that we are different from your undergraduate pre-med, stereotype. So I'm going to stop with that and let the alumni jump in. Eric, you're nodding your head.
Yeah, I think I very much agree with the idea of group studying, because I think the class size is small enough where you can really find your people and like really get to know everybody. And I feel like everyone is there to help each other. So usually usually the classes have like a big group chat, for example, like a big group chat like GroupMe, for example. And so people put resources in there, share those resources for everyone to use, which is really, really nice. But also when you find kind of like your people in the group at the IHN, I feel like it's really nice to study and talk with friends while you're studying because it is a lot of content and I think sometimes it can just be really hard to really do all this stuff by yourself. So finding that group and just in general, the whole class cohort is so willing to help each other that I've never felt that I was like ostracized or felt I like was competing with my my classmates because I think everyone was just so willing to help each other out.
Thanks. And the last question for the alumni, and then we're going to wrap up, is what were the deciding factors for you that led you to the IHN? Like, why did you guys come and get your master's at the IHN versus doing something else?
So I'll jump in there first. The reason I ended up going to get a master's in nutrition had a lot to do with the fact that I did the post back at Columbia, and I had heard about this program when I was doing the post back. And I spoke at the time. There was somebody else that was in charge of this program, and I sat down with her and we had lunch and we just talked about what the program offered, how they could help me kind of reach my goals, and everything just really resonated with me. And I just kind of want to fall back on the previous question there too, because I think it really goes hand in hand with this. I have a pretty abrasive and blunt personality, and it doesn't always vibe with everyone, but every single professor and student in this program, I don't know what it is about this program and the people that they attract, but I got along with everybody, and everybody's very supportive and helpful, and tries to do their best and like carefully guide you and mentor you. I think this program, what really drew me to it was just that first conversation, that it just kind of like showed me that I was going to get everything that I wanted from this program, kind of pushed me in the right direction. And nutrition is something that isn't really taught in medical school. And I knew that before I was going to this program, and it was something that I really wanted to take away from it. So I tried to sink my teeth into it and get all I could out of it. And I think I did, yeah.
And Eric, how did you come to us and why?
Yeah, so that's a great question. So before coming to Dartmouth for medical school, I actually applied to medical school once before. Didn't end up getting in, so I was kind of weighing my options to see what I would do in the meantime to kind of boost my application, and just like figure out what I wanted to do in the meantime. And so I actually got an email from the IHN and also attended one of these exact webinars that we're sitting in here right now. And I learned about the program, and it really enticed me to want to come. And so I applied and ended up matriculating into the program. And I feel like it really helped in a lot of ways, just because I feel like my first application, I feel like was very limited in the kind of scope of things that I did. But then coming to the IHN and also just like even before then, I thought that there were so many opportunities to do so many different things academically, kind of like educationally, professionally, that really resonated with me, that made me feel like I could boost my application to a point that I feel like I could confidently reapply to medical school and get in the next time. And so I think ultimately that's what brought me to the IHN, and it ultimately also ended up being one of the best decisions of my life because I really enjoyed being at the IHN. I still am very much connected to my friends and the faculty here, and yeah, so yeah, that's pretty much how I arrived at the IHN.
It's pretty great. That actually like had me take pause and consider, do I actually want to do a PhD in this? I enjoyed it so much, or I ended up continuing on to med school. But yeah, it's a pretty great place.
On that note, that was a great final comment. Thank you to Julianne. Thank you to Eric. I really appreciate, I know how busy you are, so thank you so much for taking out a slice of time of your lives to do this. And thank you to the participants, for prospective students. If you have any further questions, don't hesitate to reach out to us. And we look forward to seeing some of you apply. And for those who had questions specifically about schedules and part-time, please do feel free to reach out to us. Have a good afternoon, evening, or wherever you are in the US, and take care, everybody. Bye-bye.